Welcome to our video on 8 best ways to increase oxygen in the blood. Our aim is to help you improve your overall health and well-being by enhancing the oxygen levels in your blood through various methods. Feeling fatigued, dizzy, or short of breath can be signs of a lack of oxygen in the blood, known as hypoxia. Dealing with these symptoms can make everyday tasks feel exhausting and take a toll on both your physical health and mental well-being. Hypoxia occurs when the body's tissues don't receive an adequate supply of oxygen, which can be caused by factors like poor circulation, respiratory issues, or environmental factors such as high altitudes or polluted air. When cells don't get enough oxygen, it impacts their proper functioning, leading to diminished overall health. Did you know that professional athletes often train at high altitudes to increase red blood cell production? This adaptation helps them perform better at sea level since their bodies become more efficient at utilizing available oxygen. While we may not be training for elite athletic events, understanding our body's capacity to adapt can empower us to improve our own oxygenation levels for better health. In this video, we will explore various techniques aimed at increasing your blood's oxygen-carrying capacity. By implementing these methods into your daily routine, along with proper medical care if needed, you'll be taking steps towards a healthier, more vibrant life. So, let's dive in and discover the ways to increase oxygen in your blood. Number 8. Regular exercise. Engaging in physical activity increases your heart rate and muscle oxygen demand. As a result, your breathing rate increases, allowing more oxygen to enter your lungs. Over time, regular exercise improves the efficiency of this process. Regular exercise also offers several benefits for increasing oxygen in the blood. Firstly, it strengthens the heart, improving its ability to pump oxygen-rich blood to muscles and tissues. This enhances blood flow throughout the body and reduces the risk of heart disease. Additionally, physical activity helps you breathe more deeply, stretching lung tissue and improving your functional lung capacity. This can make daily activities easier and reduce feelings of breathlessness. Furthermore, as your cardiovascular fitness improves, your muscles become more efficient at utilizing oxygen. Capillaries, the tiny blood vessels in your muscles, grow and deliver more oxygen-rich blood during exercise. By engaging in regular exercise, you can naturally enhance your oxygen levels, improve cardiovascular health, increase lung capacity, and optimize your body's overall oxygen efficiency. Remember to consult with your healthcare provider before starting any new exercise regimen, especially if you have pre-existing health conditions. Number 7. Deep breathing exercises. Now, let's take a deep dive into the world of breathing techniques like pursed lip breathing and diaphragmatic breathing, and how they can significantly enhance lung efficiency and oxygen uptake. First, let's talk about pursed lip breathing. This simple yet effective technique involves inhaling through the nose and exhaling slowly through pursed lips, almost as if you're whistling. The slow exhale causes back pressure in the airways, which helps keep them open, allowing more air to flow in and out of the lungs. This technique also slows down the breathing rate, which can help improve the exchange of oxygen and carbon dioxide. The American Lung Association highlights the use of pursed lip breathing to manage shortness of breath and improve lung efficiency, particularly in people with lung conditions like COPD, chronic obstructive pulmonary disease. However, anyone can benefit from this technique, especially during strenuous activities that could cause rapid or shallow breathing. Next is diaphragmatic belly breathing. Also known as deep breathing or abdominal breathing, this technique focuses on fully engaging the diaphragm, a dome-shaped muscle at the base of the lungs that plays a crucial role in breathing. When you breathe in, your diaphragm contracts and moves downward, creating a vacuum that pulls in air into your lungs. When you breathe out, your diaphragm relaxes and moves upward, pushing air out of your lungs. However, many people develop a habit of shallow breathing, using only the upper chest. Diaphragmatic breathing helps to correct this pattern, encouraging deeper breaths that fill more of the lungs with fresh, oxygen-rich air. A 2017 study published in the Journal of Physical Therapy Science found that diaphragmatic breathing could improve lung function and respiratory muscle strength. The study showed that the technique could be particularly beneficial for individuals with chronic respiratory diseases, like COPD. Incorporating these breathing techniques into your daily routine can be a game changer. Not only do they help improve your lung efficiency and oxygen uptake, but they also have the added bonus of being calming and stress relieving. Remember, as with any new health practice, it's always a good idea to consult with a healthcare professional or a trained respiratory therapist before starting these breathing exercises, particularly if you have a pre-existing lung condition. They can provide guidance to ensure you're doing the techniques correctly and safely. Number 6, maintaining good posture. You might not have considered it before, but your posture can have a significant impact on your breathing. When we're slouched over, the diaphragm, which is a primary muscle used in breathing, is compressed, reducing its ability to help your lungs expand. This means that when you're hunched over, you're not using your full lung capacity, leading to less efficient oxygen intake. On the other hand, sitting up straight or standing tall allows the diaphragm and chest to expand fully. This better posture opens up the chest cavity and gives the lungs more room to expand, increasing their capacity to take in oxygen. In a 2006 study published in the Journal of Physical Therapy Science, researchers found that bad posture could lead to decreased lung capacity and that posture correction could improve lung volume and oxygen saturation in the blood. The researchers concluded that maintaining good posture could be a preventive method for diseases caused by insufficient respiratory function. Good posture isn't just about looking confident or maintaining spinal health. It plays a critical role in our ability to breathe efficiently. This is why many meditative and physical exercise practices like yoga and Pilates place such emphasis on maintaining proper posture. It isn't just good for your back, it's good for your lungs too. So next time you find yourself slumping in your chair or hunching over your phone, remember that a simple adjustment to sit up straight or stand tall could be a quick and easy way to give your body a little extra oxygen. As a bonus, it can also reduce tension in your neck and shoulders, and may even improve your focus and mood. At number 5, staying hydrated. Our bodies are made up of about 60% water, and our blood, as you rightly pointed out, is about 92% water. This clear, life-giving fluid serves as the primary transportation system in our bodies, delivering essential nutrients and oxygen to cells and removing waste products. Water helps maintain the volume of blood in our bodies. When we're well hydrated, our blood is more fluid and circulates more easily, which allows red blood cells to effectively deliver oxygen to the tissues. In contrast, when we're dehydrated, our blood can become more concentrated and viscous, which may impede circulation and limit oxygen delivery. A study published in the American Journal of Clinical Nutrition in 2002 indicated that even mild levels of dehydration could impair physiological responses and performance, affecting aspects like metabolism and heart rate. Another study published in the European Journal of Nutrition in 2018 showed that maintaining adequate hydration could positively impact blood viscosity and flow. Furthermore, adequate hydration is crucial for the production of lymph, an important component of your immune system that also circulates in your body like blood. Lymph carries immune cells to fight off infections and is largely composed of water. So how can you ensure you're drinking enough water? While the common advice is to drink 8 8-ounce glasses of water a day, the actual amount you need can depend on various factors such as your age, sex, weight, activity level, and overall health. Foods with high water content, such as fruits and vegetables, also contribute to your daily water intake. Remember that it's easier to stay hydrated by sipping water throughout the day than to try and rehydrate once you're already dehydrated. And while you're hydrating, remember that the water you're drinking is playing a vital role in transporting oxygen around your body, boosting your energy, and keeping your system running smoothly. Number 4, eating oxygen-rich foods. The food we consume plays a vital role in maintaining our overall health, including the health of our blood and its oxygen-carrying capacity. Let's explore how specific foods, such as leafy greens, beets, and iron-rich foods, can boost red blood cell production and increase oxygen levels in our bodies. Firstly, leafy green vegetables like spinach, kale, and Swiss chard are excellent sources of folate, also known as vitamin B9. Folate is crucial for the production of red blood cells as it assists in DNA and RNA synthesis, which is essential for generating new cells, including red blood cells. Insufficient folate levels can lead to anemia, a condition characterized by a low red blood cell count resulting in fatigue and weakness. Secondly, beets are rich in dietary nitrates, which have the remarkable ability to enhance your oxygen-carrying capacity. When consumed, these nitrates are converted into nitric oxide within the body. Nitric oxide acts as a vasodilator, widening the blood vessels and improving blood flow. This increased blood flow allows for more efficient oxygen delivery to your muscles and other tissues. Research, such as a study published in the Journal of Applied Physiology in 2017, suggests that dietary nitrates derived from beet juice can enhance the efficiency of mitochondria, the energy-producing powerhouses of our cells. Lastly, iron-rich foods play a crucial role in maintaining optimal oxygen transport within our bodies. Iron is a key component of hemoglobin, the protein found in red blood cells that binds to oxygen and carries it from the lungs to the rest of the body. Including iron-rich foods in your diet, such as beef, chicken, seafood, beans, and fortified cereals, helps ensure an adequate supply of iron for the production of healthy red blood cells. To enhance iron absorption, it is recommended to pair these foods with a source of vitamin C, such as citrus fruits or bell peppers. Iron deficiency can lead to anemia, which compromises your body's ability to effectively transport oxygen. By incorporating leafy greens, beets, and iron-rich foods into your diet, you can support the production of red blood cells, improve oxygen-carrying capacity, and enhance overall health. However, it's important to note that individual nutritional needs may vary, and consulting with a healthcare professional or registered dietitian is beneficial for personalized dietary guidance. Remember, the food choices we make can have a direct impact on our blood health and oxygen levels. So, let's nourish our bodies with these nutrient-rich foods and enjoy the benefits of increased red blood cell production and optimized oxygen transport. At number 3, oxygen therapy. Supplemental oxygen is often recommended for people with conditions that affect the lungs' ability to effectively absorb oxygen, such as chronic obstructive pulmonary disease, COPD, asthma, pneumonia, lung cancer, and cystic fibrosis. It can also be used in cases of severe sleep apnea, a condition that intermittently blocks the airway during sleep. The purpose of supplemental oxygen therapy is to help maintain safe oxygen levels in the blood, thus ensuring that sufficient oxygen reaches the body's tissues and organs. It's not about boosting oxygen levels beyond what's normal. Rather, it's about maintaining oxygen levels within a healthy range. A 2018 review published in the journal Respiratory Care found that long-term oxygen therapy improved both survival rates and quality of life for individuals with COPD and persistent hypoxemia, which is a lower than normal concentration of oxygen in the blood. Oxygen therapy can be administered in various ways, including through a nasal cannula, a flexible tube with 2 prongs that fit into the nostrils, a face mask, or a tube inserted directly into the windpipe. It's important to note that while supplemental oxygen can be life-saving for those who need it, it's not necessary or beneficial for healthy individuals with normal blood oxygen levels. Excessive oxygen can be harmful, causing side effects such as dry or bloody nose, skin irritation from the delivery devices, or even oxygen toxicity if used improperly. Always remember, the use of supplemental oxygen should be prescribed and overseen by a healthcare professional. It's crucial to follow their guidance on how to use it safely and effectively. At number 2, avoiding carbon monoxide. Carbon monoxide, CO, is a silent yet potentially deadly gas, and it's essential to understand its impact on our health and how to protect ourselves. Carbon monoxide is colorless, odorless, and tasteless, which makes it extremely difficult to detect without the aid of a carbon monoxide detector. It is produced during the incomplete combustion of carbon-containing fuels such as gas, oil, coal, and wood. This can occur in various situations, such as when you're smoking, using a gas stove or oven, or when there's a running car in a closed garage. When you inhale carbon monoxide, it enters your bloodstream and binds to hemoglobin, the molecule in your red blood cells responsible for carrying oxygen from your lungs to the rest of your body. The problem is, carbon monoxide binds to hemoglobin over 200 times more strongly than oxygen does, forming a compound called carboxyhemoglobin. This reduces the amount of oxygen that can be transported in the blood, which can deprive your body's tissues and organs of the oxygen they need to function properly. Chronic exposure to lower levels of carbon monoxide, like from regular smoking or consistent exposure to secondhand smoke, can lead to symptoms such as headaches, dizziness, weakness, nausea, shortness of breath, and confusion. In severe cases or with acute exposure to high levels of carbon monoxide, it can cause loss of consciousness and can be fatal. Several studies, including one published in the Journal of the American Society of Hematology in 2018, have highlighted these harmful effects of carbon monoxide and stressed the importance of public awareness and preventive measures. So how can we protect ourselves? First and foremost, avoid smoking and exposure to secondhand smoke. Not only does this reduce your exposure to carbon monoxide, but it also decreases your risk of lung cancer, heart disease, and numerous other health conditions. Ensure good ventilation when using gas appliances or lighting a fireplace. Install carbon monoxide detectors in your home and test them regularly to ensure they're working. Remember, knowledge is the first step to prevention. By understanding the risks associated with carbon monoxide and taking proactive steps to minimize exposure, you can help protect your health and the health of those around you. Stay safe and breathe easy. Number 1, getting fresh air. Taking a breath of fresh air outdoors can do wonders for increasing your oxygen intake, especially in areas abundant with plants and trees. Let's explore why this is the case. Plants, through a process called photosynthesis, convert carbon dioxide into oxygen, releasing it into the air. They are nature's oxygen factories. When you step outside into areas with rich vegetation, you're surrounded by an environment that naturally produces oxygen. This is particularly evident in areas with dense forests, parks, or gardens. The lush greenery generates a higher concentration of oxygen, creating a refreshing and revitalizing atmosphere. Research has shown that spending time in nature, also known as forest bathing or nature therapy, can have numerous health benefits, including reduced stress, improved mood, and enhanced immune function. Furthermore, being outdoors often means you're engaging in physical activity, whether it's taking a walk, going for a hike, or participating in outdoor sports. Exercise increases your breathing rate, allowing you to take in more oxygen and improve your overall lung capacity. The combination of fresh air and physical activity can be invigorating and help oxygenate your body. It's worth noting that the concentration of oxygen in the air remains relatively constant regardless of location, around 21%. However, the quality of air can differ due to factors such as pollution, altitude, and surrounding vegetation. Being in areas with abundant plants and trees can create a more pleasant and oxygen-rich environment. So, make it a habit to step outdoors, breathe in the fresh air, and connect with nature. Whether it's a stroll through a park, a hike in the woods, or simply sitting under the shade of a tree, you can enjoy the benefits of increased oxygen intake and the therapeutic effects of being in a natural environment. As always, be mindful of any environmental factors such as air quality or allergens that may affect your respiratory health. If you have specific concerns, consult with a healthcare professional for personalized guidance. And there you have it, 8 best ways to increase oxygen in the blood. Increasing your oxygen intake can be achieved through various means, including physical activity, proper posture, hydration, and being mindful of environmental factors. Incorporating these practices into your daily routine can have a positive impact on your overall well-being and support optimal oxygen levels in your body. If you found this information valuable, we'd appreciate it if you hit the like button and share this video with others. Don't forget to subscribe to our channel and turn on the notification bell to stay updated on our latest content. Your support helps us continue providing educational videos like this one. And if you'd like to go the extra mile in supporting our channel, you can also use the Super Thanks feature. Super Thanks allows you to express your appreciation and contribute to the creation of more valuable content. Remember, oxygen is a vital element for our bodies to function at their best, so let's make conscious choices to increase our oxygen intake and enjoy the benefits of improved health and vitality. Thank you for watching, and we'll see you in the next video. Breathe easy and take care.